Argentine Consulate General and Promotion Center in Barcelona welcomes you to this session in which 5 small and medium Argentine enterprises will present their products related to clinical research solutions, telemedicine solutions, and telerehabilitation solutions. First of all, we will hear from Georgina Sposetti, investigator, specialist in clinical research, CEO, and founder of Un Ensayo para Mí. This is the first clinical trial search engine that matches patients with investigations in Latin America.
Okay, thank you very much. Thank you for this time. I'm Georgina Sposetti. I'm the CEO and founder of Un Ensayo para Mí. Our company in English will be a clinical trial for me. So I want to present our company. What is Un Ensayo para Mí? Un Ensayo para Mí is a patient-friendly web search engine for clinical trials. We organize all the information available on approved clinical trial in a safe, updated way using patient-friendly language. Un Ensayo para Mí is a platform where patients and investigators can get in contact. But why this platform? We have a huge problem worldwide, even in the middle of the pandemic. The problem is that about 80% of clinical trials fail to accomplish the screening time, and our community has a weak awareness and a lack of information in clinical trials. But why we developed this platform? A little story from myself. I'm an investigator and I have been working in clinical research as an investigator for more than 15 years. But one day I found myself on the other side. I was diagnosed with a very rare disease. And of course, the first thing that I did was to look for a clinical trial for me. And at that moment, I realized how hard it is for any patient who doesn't have any technical knowledge find a clinical trial by themselves. But the most difficult part for me was to connect with the right investigator and with the right trial. So that is why Un Ensayo para Mí was born. We have 3 main objectives in our company. The social one is to build awareness of clinical trials and to democratize information. The second one is the productive one, to speed up recruitment of patients. We help pharmaceutical company and also investigators to accomplish the screening time. And the third one is the global one, to bridge the gap between patients and doctors. We want to connect patients with the right trials, with the right teams. This is our platform. Our platform has different sections. The most important one is the search page. It's an easy and friendly, and the patient has to write his illness, and with this data, the search engine will give the patient a list of all clinical trials that are carried on in each country. And after that, if the patient chooses one, can see all the details of this study, inclusion or exclusion criteria. And after that, the patient can see a list of all sites that are working on these trials, and they can choose the nearest site. And with just one click, patient and investigator can get in contact. The other section is our educational section. On this page, patient will have all the information they need to make the right choice. Videos, written materials, news, articles, and interviews about these fields. We work closely with patient association. We have created a network to share and viralize information directly with patients. And how do patients can reach the platform? Through social networks. We use digital means and social networks to reach patients. We are where the patients are. The social media network are the biggest pre-screening database that we've ever had. What we do there, we work mostly in two different types of campaigns, recruiting campaigns and awareness campaign. We develop and design different posts. For example, this is one for breast cancer, and the patient who wants more information click this post, and every click lands in the page of the study that we are working on. After that, we have an online questionnaire, a chatbot, a virtual assistant with AE, with different pre-screening questionnaire, and this questionnaire allows people to know if this trial is fitted for them. So after that, if the patient accepts and matches all the criteria, is the patient contacted by our community assistant team to help them to contact directly with the investigator and also clarify any doubt or concern that patient could have about clinical trial in general. So our work ends when the patient and investigator meet. These are our clients right now in Latin America. We are working in different campaigns, in different pathologies, specialists, with all big pharma in Latin America. We are working right now in Argentina, Mexico, Colombia, Chile, and also Brazil. And we hope to launch late 2021 in Spain and Portugal. So this is our company. This is Un Ensayo para Mí. Thank you very much.
Enough for the presentation. Let me introduce you to Guillermo Rodriguez and Ricardo Rival, both co-founders at ModMe, a health tech company focusing on improving the rehabilitation process for patients and caregivers.
Good afternoon, everyone, and thanks for the introduction, Carolina. I'm Guillermo Rodriguez, co-founder at ModMe. At ModMe, we're focused on improving the rehabilitation process by bringing it closer to the patient, using innovative and low-cost technologies in a holistic approach. As people said, a picture is worth 1,000 words, so let me start by playing a short video where you can see some of the functionalities that ModMe has to offer. The rehabilitation process has certain problems we believe could be improved by using the right technologies. Quite often, patients tend to lose interest in the treatment after some time, leading to a lower adherence to the treatment. Additionally, there is a need for patient monitoring tools during the rehabilitation process. Chronic treatments can last for years, so collecting information and calculating metrics to analyze the patient progress is important for adjusting the treatment. When the rehabilitation continues at home, there are few tools to assist patients and facilitate communications with caregivers. All this happens where people live longer, in many cases adopting unhealthy lifestyles that put additional pressure on the health system, including, of course, rehabilitation services. COVID-19 aggravated the situation by forcing professionals to serve their patients remotely. Caregivers have a challenge when trying to provide services to a diverse population of patients, in many cases requiring interdisciplinary and long treatments. A holistic approach where patients are viewed from different angles and with different objectives is important to build simple and complete solutions. We're trying to do that with a product that integrates multiple facets of the rehabilitation process. Our solution focuses on patient motivation through the use of motion tracking technologies combined with virtual reality and animated therapies. We create immersive experiences where patients forget they are rehabilitating, increasing the adherence to the program. Along the process, we capture information on patients' performance so it can be stored to be analyzed later. We combine all this with industry-accepted tests for patient evaluation, which help professionals to have a more complete understanding on how their patients are doing. If necessary, the information could flow in and out from existing electronic health record systems. All this while supporting home-based therapies, something critical nowadays with COVID-19 still among us. MODMI combines all of the concepts I just described in an integrated platform where therapists can use different tools and strategies to serve their patients. The platform is continuously evolving to support new and changing needs from our customers, like the addition of one-to-one calls, messaging tools, digital rehabilitation catalogs, and animated therapies. All these functionalities are helping professionals with treatment during COVID-19 lockdown. The market opportunity for MODMI is big. Although our current focus is on rehabilitation practices and nursing homes, there is also potential on well-being and preventive care solutions. Governments and companies are encouraging and sometimes rewarding people to adopt healthier habits and to take a proactive role on their health. The rehabilitation market, just in developed countries, is over $100 billion a year, and solutions like ours can capture a portion of that. People are living longer and the world population is aging. That, coupled with unhealthy lifestyles, presents opportunities for new preventive physical therapies. According to the United Nations, 9% of the world population is 65 and older. In developed countries, that figure goes up to 16% and will be 25% in year 2050. Making sure senior people maintain active and healthy is important to lower the impact on health services. We know there are challenges in addressing the heterogeneous need and serving different types of customers. That is why we have a hybrid business model open to partners in key markets where we plan to sell our own devices in the future. From the beginning, we set our goal to build a generalistic platform that could be used with most patients regardless of the underlying pathology. Many solutions on the market are based on the use of a particular technology, built upon a particular functionality, or targeting a particular pathology. Initially, we took the same approach, but soon we realized it wasn't enough to help our customers solve many of the problems they face when delivering the rehabilitation services. Our customers tell us that being able to combine different tools and technologies in a single platform was decisive for them in adopting our solution. Since the beginning, we laid out a multidimensional strategy that has been our reference. Right now, we're working on our internationalization, establishing partnerships on some markets. At the same time, we continue to improve the product and obviously continue what will come next. Most of our customers are in Argentina, where we operate commercially since 2017. During last year, we added customers in neighboring countries, and early in this year, we got our first customer in Spain. We're rolling out a distributors programs where we partner with key local players to help us open up or expand our presence in different markets. Europe, with the help of our local partner in Spain, and the rest of Latin America and North America are our next targets. Together with my partner Ricardo, we lead an interdisciplinary team of talented people with experience in technology and healthcare. Along with them, we have experienced business and medical advisors and the support of some private and public organizations to help us move forward. Our future plans include creating our own devices, and we also plan to adopt artificial intelligence tools and techniques to improve our product. All this will continue our expansion to new markets. Until the end of October, more than 60 centers and universities in 5 countries have used MODMI. These entities enroll over 2,000 patients who took place on more than 10,000 on-site sessions and completed over 32,000 remote sessions. In essence, this is MODMI. Although we still have a lot to do, the results we're seeing and the feedback especially we're getting from our customers, are very encouraging to continue our goal of bringing rehabilitation closer to more people. Thank you very much.
Thank you very much for your presentation. And now we will hear from Omnia Salud, that provides a cloud-based electronic health record and practice management solution that integrates clinical workflows with administrative workflows for virtual and physical care.
Hi, thank you very much. Thank you very much for the presentation. It's a pleasure for us to be here. My name is Matias, and I am the CEO and founder of Omnia Salud. So we've seen across many industries how COVID has paved the way for the transformation that was already happening, get kind of fast forward as the digital channels gain more and more traction, right? So in retail, for example, it was very obvious as we saw e-commerce transactions fly through the roof, but this was not something that happened overnight. We're talking about industries in which the whole ecosystem, including marketplaces, e-commerce platforms, payment solutions, and everything else, have been growing steadily for the past 15 years, and this was just turning up the volume or was already developed. So it was kind of switching the button from physical to digital, but just carrying the operation from to the digital channel, right? So on the other hand, we saw how healthcare basically stopped, except for everything obviously that was COVID related, basically because the whole ecosystem was so unready to continue, including not only the technology, but in some cases even the legal framework. So that is why we saw many very important specialties such as oncology or cardiology drop in such a drastic way during the pandemic. So that's why I like to think of digital health kind of like e-commerce 15 years ago, with so much of the biggest wave of disruption still to come ahead. So the impossibility to carry out in-person visits during the pandemic had an immediate boost on the telehealth solutions. But as important as that is, this is just the tip of the iceberg regarding the process of health digitization. So we were left with the consult just as the only means of getting any sort of any medical attention, but the digitization process goes far beyond the teleconsultation, unlocking all the medical information and integrating physical and virtual channels of attention, as well as the many clinical processes that exist in complex institutions, which in turn also they have to be integrated to the administrative workflows that are required to carry on the operation, including electronic health records, agenda management, and of course, billing. So in Omnia Salud, we have built a comprehensive cloud solution that fully integrates complex clinical workflows with the administrative areas and telehealth in order to build a fully digitized, to build a solution that fully digitizes the operation of a medical center. And we built the solution with the electronic health record at the heart of the application, thinking about the medical information and the clinical processes as the most important part of the system. So as we always say, patients go to medical centers to become healthier, not to be scheduled and billed. So that's why the system the system that we use should pay particular attention to the clinical area. So as you can see, our platform incorporates the complexity that a mid-sized medical center will have regarding the areas of scheduling, such as holding agendas for all the professionals, all the services, automatic reminders, website scheduling, a waiting room, and a comprehensive health record, which is not just medical notes, but also all the processes that are included within the medical processes of such specialty and that work towards medical coordination. Also, as we integrate our problem list with medical terminology solutions, so that professionals can write in their own everyday medical language, but we translate that using different tools into medical codes such as SNOMED or ICD. And also, the teleconsultation is fully integrated into the process. So as the new normal is just starting to become normal, professionals are starting to integrate physical consultation with digital consultation, right? Also as a means to keeping waiting rooms not so crowded. So if they want to see a virtual patient, they will use the same solution to schedule and build the appointment, and they will have all the information from the previous virtual or in-person visit, but they will just press a button to open the virtual appointment in their computer instead of just calling them into the examination room. So all of this information will also generate the necessary information to keep up with the billing requirements of your health system, as we've adapted to insurers, social payers, and private practices as well. So just so that you can get an idea of what we say when we say we cover complex medical processes, I will show you an example of our oncology solution. So through the web self-scheduling, you will be able to get an appointment with a specialist that's going to take a look at your exams and talk about your condition. Obviously, this could be an in-person visit if that was possible. And with all that information, the specialist will define the chemotherapy treatment that you will require that consists in a very specific amount of sessions and the drug mix that you will get in each of those sessions. This information will go to your EHR, of course, but it will also feed the scheduling system so that you can find the exact spots that will match the requirement of your treatment. So you will need to spend many hours in a very specific sequence of visits, which is not something easy to handle manually, as we saw while we were building the solution. And the patient will get automatic reminders of each visit. And when he shows up, the nurse will see the exact indications that he needs to be done and will input all the information generating during the sessions into the EHR, which the specialist is going to be able to monitor and adjust. And all of this as well will generate all the necessary information that's necessary so that the billing module can know how much to charge the insurance company or the indicated payer. I've included another graph, but for the sake of time, I'm not going to get into it, but just to show you another example of assisted fertility, where you have many specific clinical processes, including stimulation, surgery procedures, in vitro fertility. So just so that you can get an idea of what we're talking about when we say we cover complex medical processes that need to coordinate different areas, as well as the administrative tasks that are related to those processes. So basically, we offer a full SaaS product in which we charge a monthly subscription that includes different modules and configurations of the product depending on your size and needs. We have solo practices that use the basic setup of the product. And of course, as the medical size is bigger, or you're a specialty center, you have more complex processes, which of course will require you to use higher tiers of our plans. And for the higher tiers, we also offer the possibility to integrate our solution with another software that you may already use using standardized languages such as HL7, which is the one we use mostly. So in our founding team, we have experience working in some of the top tech companies in the world, such as Google, LinkedIn, or Globant, and experience in other tech startups in Latin America, combined with the experience of Mauro, who is a cardiologist with more than 10 years of experience in health IT. So that's why our different profiles kind of help us drive this vision that we have of looking at healthcare, but through the lens of technology. At the moment, we have more than 100 medical practices that are using our solution throughout Chile, Argentina, Mexico, and Bolivia. And we're also part of the Startup Health Network, which I'm happy to have seen other companies as well during this event, which is an organization that helps health transformers throughout the world coordinate their actions in order to have a bigger impact. We have more than 5,000 physicians that enter our platform on a daily basis and about 1 million patients registered, about 1 million patients that have their EHR in our solution. So at this stage, we're looking for the right partners and customers to help us get traction in Spain, and from there focus on the European market. We basically believe that the digital first model in healthcare will start to develop, where interactions will definitely begin virtually, and then they will interact with the physical world as needed. We want to help medical providers go through this transition successfully, and we want to help them providing the technology that we believe they're going to need. So thank you very much, and please keep in touch if you're interested.
Thank you for your presentation. And now we will hear from Andrés Lawson, CEO and founder of Osana Salud, which is a leading telehealth platform in Latin America, enabling healthcare and access to more than 5 million patients.
Hi, everyone. Thank you very much for joining us today. My name is Andrés Lawson, and I'm one of the founders of Osana Salud, one of the leading telehealth platforms in Latin America. To give you a brief insight about myself, I co-founded 2 firms before, Emporio Commerce, an e-commerce agency, and the Fiti, the largest online fashion e-commerce in Latin America. Currently, I'm the CEO of Sana Salud, and today I'm here to tell you a little bit about what we're working on. So Sana is a software as a service platform that's used by medical providers to connect with patients and deliver virtual care. We are using technology to reduce the cost to serve and provide best-in-class user experience to obtain better results from our patients. We're basically building the API for the healthcare industry. We provide a full stack of functionalities, including online appointments, a video consultation platform for doctors to deliver virtual care, electronic health records, online drug prescriptions, and all with the possibility of integrating valuable information and obtaining better results for the patient. Our API connected healthcare infrastructure provides an end-to-end solution to digitalize primary care. We're the engine that empowers and moves all of these services just mentioned, and each of our clients, which are mainly health insurance firms, can customize the front end or embed our services through their mobile app and through their own backend. Here today, I would like to share we can as well provide a custom front-end design for our APIs. So we can have our APIs embedded in the services of our clients, or we can as well provide the custom front-end design for each of the services. I would like to share today some case studies of how our APIs are being used along the different value chain in the healthcare industry. So I'm going to start with a public health insurance company who at the beginning of the lockdown here in Argentina faced the problem of having 4 million elderly patients who were restricted from visiting their family doctors due to the lockdown. So we implemented a tailored solution embedded in our client's app, where we provided our online booking API, our video consultation API. We provided online medical prescriptions, and all embedded through WhatsApp notification. One of the main challenges here is that all of the patients of this public health insurance firm are over 65 years old. So we had the challenge of tailoring a solution that would be very easy for people to use. So basically, we implemented all this, and we are enabling video consultations with just one click for the patients, all notified through WhatsApp. In our first month of operations, we have onboarded more than 5,000 doctors, and we performed more than 20,000 video consultations, obtaining a Net Promoter Score of over 87%, all with a target segment of who is usually technology challenged. No? We have another service, which is basically an AI chatbot, which is an API, which basically sends automated messages to our patients and records and automatizes the information, the gathering of the information. And we're basically using it for preventive care. So let me show you another case example here of how our API is empowering healthcare services and providing better results for patients. So basically, we're working with a private health insurance company whose problem is that chronic patients were not checking in with their doctors or monitoring their health conditions. So, and this with the risk of having these patients get a more acute condition and have to visit the hospital in person. So it's very important to monitor their health, their vital signs. So we implemented an AI chatbot solution, which is basically an automated questionnaire based on each different pathology. So we segmented the clients according to the different chronic diseases, and we implemented a questionnaire to track the evolution of their chronic disease. And 1 month after our launch, we are currently tracking 30,000 chronic patients with more than 10 different pathologies. We're sending a WhatsApp questionnaire with different frequency. We are obtaining 60% of response rate, which is a very, very, very high number. And actually, we are as well integrated with video consultations. So if we we understand that a patient is not doing okay, or that he needs to perform a doctor checking, we basically provide an instant video consultation. And we have found out that 20% of the client or the patients we're monitoring actually required an action from their general practitioner or their family doctor. This is how we are empowering the healthcare industry in Latin America. We are digitalizing and providing world-class experience for our patients, working with the with a leading private and public health insurance firm in Argentina. And we're currently expanding our operations internationally. So if you would like to know more about our solutions, please get in touch with us. Thank you very much.
Thank you for your presentation. And our last presentation for this afternoon will be by Ingrid Brigiler, medical gynecologist and obstetrician. She's the founder and CEO of Llamando al Doctor, which is a telemedicine company that connects doctors and patients through a web and a mobile application.
Okay, hello. Do you see well?
Yes, we hear and we see you.
Okay. Hello, everyone. I'm Ingrid Brigiler from Argentina. I am a gynecologist, and 4 years ago, I founded Llamando al Doctor, which in English means calling the doctors. And we like to say that we are a doctor on your smartphone because we want to democratize healthcare access in all the population in the world. The problem we have identified is that patients have health questions and want a quick answer without leaving their house. And also, 86% of medical consultations require low complexity solutions. This is why we created a simple and innovative solution, which is especially useful for insurance companies who want to offer services for their insurees. The patient or the family can talk with a doctor through a video call, and all the consultation records being in the history medical records in Llamando al Doctor. We offer an end-to-end solution which is affordable for our clients and free for our patients. Our value proposition is 24/7 health service and technical support. We offer various medical specialties and high-quality professional services because we hire doctors from the best hospital in the region. We can custom the app layout for each client as well. Our competitive advantages is our immediate and high-quality service. We have a patient experience team that hears what patient wants, and we offer and we are expert on on-demand service. This is why we offer a video consultation with only 2 minutes of waiting time. We have our own medical staff. We have 300 doctors, but of course we can work with our clients' doctors as well. In the last 6 months, we treat more than 250,000 patients. So we have a big impact in all these patient lives. This is our service portfolio, which is a comprehensive remote service with lots of useful functionalities for the patients. But especially with the COVID-19, we have patient monitoring. We identify suspected case for COVID-19 and we follow on to the recovery. This is an example of look and feel. We can be a button into the app of our client, and our clinical history and electronic prescription is of course encoded and encrypted. We work with pre-approved Vademecum digital signature for our doctors, and we have, of course, webhooks integrations. This is an example of our electronic prescription. But what about our numbers, our company's impact in numbers? Our clients can save 40% due to virtual consultation as replacement for on-site ones. And which is more important, we solve 66% of the consultation without the need of referral the patient. And this is a general number, but if we talk about the patient with COVID, we solve 95% of this consultation without referral. I want to show you an example of one of our customers in one month. We have 25,000 medical consultations in only one client. We solve 96% without referrals, and we have a very high rating by the patients. This is our user rating. All our patients are very happy with our services, so we are too. And this is the company that just asked. We have lots of companies because we have 4 years of working on it, and we have health insurance company and insurance company as a client. We are now in all these countries of Latin America, and we reach 5 million users in now. But we want to expand to Spain in the next month. This is our team. We are experts in business. We are experts, of course, in medical solution and in medicine too, and in technology. This is our press coverage, and this is all for calling the doctor, for llamando al doctor. I cannot put the last slide, but this is all. I don't have the last one. If you want to call me, please write me at ingrid@llamandoaldoctor.com.
Thank you very much, Ingrid, for your presentation. Thank you to the 5 companies that participated today, and thank you for everyone who was listening to them. I hope it was very fruitful for everyone.